Let me start with a few simple questions. When was the last time you saw your cat fully groom herself? Not just a few quick licks, but a proper grooming session, cleaning her back, her hips, her belly, and the base of her tail. Have you noticed her fur looking greasy, clumped, or dull lately? Do you see mats forming in places she used to keep spotless? And here's the most important question. Did this change happen slowly, almost so slowly that you barely noticed it? If you're nodding right now, you're not alone. These are the exact questions I ask cat owners every week in my clinic. How vets look at this problem. As a veterinarian, I want to be very clear. When a cat stops grooming normally, we do not see it as a grooming issue. We see it as a comfort and mobility issue. In American veterinary medicine, grooming behavior is used as an early indicator of pain, especially in senior cats. It tells us how well the body is moving, long before obvious signs like limping appear. So, before assuming your cat is lazy, depressed, or just old, we step back and ask one question. What movement does grooming require? And what could be making that movement painful?
One of my clients asked me this. Doctor, she still eats well and uses the litter box. If she was in pain, wouldn't I see it? That question matters because it highlights the biggest misunderstanding about pain in cats. Why this happens. Here's the medical truth based on American veterinary research. Cats hide pain extremely well. Evolution trained them to do that. Instead of crying or limping, cats change behavior. Grooming is one of the first behaviors affected because it requires spinal flexibility, joint compression, balance and muscle strength, repetitive twisting motions. According to large U.S. studies using X-rays and CT scans, more than 90% of cats over age 12 have osteoarthritis, even when owners believe their cat is healthy. Arthritis most commonly affects the spine and hips, the exact areas needed for grooming the back and tail base. So the sequence looks like this. Joint inflammation, movement causes discomfort, brain avoids painful motion, grooming decreases. This is not a behavior choice. It is a neurological pain response.
What pattern vets see? Clinically, we see a classic pattern. Cats continue grooming easy areas, face and chest, but stop grooming hard-to-reach areas, back, hips, tail base. When I see that pattern, arthritis moves to the top of my diagnostic list. Home observation. Safe at-home checks. You don't need medical tools to notice early signs. At home, observe these. Does your cat hesitate before jumping? Does she stretch less than before? Does she groom in short sessions instead of long ones? Does she avoid twisting her body? Also, check the coat. Greasy fur along the back. Mats near the tail. Dandruff from reduced grooming. These are comfort signals, not hygiene problems. Conditions other than arthritis. While arthritis is the most common cause, other conditions can contribute. Dental pain, licking hurts, muscle loss in senior cats, old injuries, obesity, increasing joint load, nerve pain. All of these reduce comfortable movement. Treatment, what actually helps. Treatment focuses on pain control and joint support. In American veterinary practice, this may include vet-approved pain medications, never human pain meds, joint supplements like glucosamine and chondroitin, omega-3 fatty acids for inflammation, and weight management to reduce joint stress. Many owners are shocked to see grooming improve once pain is controlled.
Home management and remedies. Safe, supportive care. At home, small changes make a big difference. Soft, warm bedding, ramps or steps instead of jumping, gentle brushing to help with missed grooming, warmth therapy for stiff joints, keeping food, water, and litter easily accessible. These changes reduce daily strain on painful joints. Your cat is not ignoring herself. She is adapting to discomfort. When grooming changes, your cat is communicating the only way she can.